Bones of the Skeleton lecture. The objectives for this lecture are to identify the two major subdivisions of the skeleton and list the bones found in each area, compare and contrast the differences between a man and a woman's skeleton, and list and compare the major types of joints in the body and give an example of each. So there are two main divisions of the skeleton. There is the axial and the appendicular skeleton. The axial means the bones of the center of the body, so we're talking about the skull and the spinal column. The appendicular means the bones of the appendages or extremities. As you can see here, we have 80 total bones in the axial skeleton, consisting of the skull, spine, and thorax, and the appendicular skeleton has 126 bones, which contain the upper extremities and the lower extremities. There are 206 total bones in our body. Divisions of the skeleton. The skeleton is composed of the following subdivisions. There are two main subdivisions of the axial portion. There's the spine or the vertebral column. The skull also is in this division. The skull contains 8 bones with immovable joints called sutures, and the face has 14 bones. The vertebral column consists of separate bones connected in a way that forms a curvature of the spine. The spine has 4 normal curves. The spine consists of 5 major parts. The cervical spine, which is your neck, has 7 bones. The thoracic, which is your upper to mid back, contains 12 bones. Your lumbar or lower back contains 5 bones. The sacrum consists of 1 bone, and the coccyx or the tailbone is 1 bone when you're an adult. When you are born as a child, it is 3 bones and then fuses together. There are 3 abnormal types of curvatures of the spine. There's lordosis, or also called swayback, where you will see the stomach protruding out. Kyptosis, which is a hunchback, and scoliosis, where there's curvature from side to side of the spine. The thorax is composed of 12 pairs of ribs, sternum or the breastbone, and the thoracic vertebrae. At the very end of the sternum or the breastbone, you will have the xiphoid process, which is the very tip. And oftentimes we are looking and feeling for that when we are doing CPR so we don't break that off. Ribs, there are 3 types of ribs. There's true ribs, which rib pairs 1 through 7 are true ribs, and they attach to the sternum directly. Then we have the false ribs just below that, which are pairs 8 through 10. They attach to costal cartilage, which attaches to the sternum and the 7th rib. And then we have the floating ribs, which are pairs 11 and 12, and they attach to the spinal column but do not attach to the sternum at all. The skeleton is composed of the following divisions and subdivisions, and now we're going to talk about the appendicular skeleton, which consists of 126 bones. These bones can consist of the shoulder or the pectoral girdle, which connects bones of the upper extremities such as the arm, forearm, wrist, and hands, and they attach to the axial skeleton. The bones in the hip or pelvic girdle connect to bones of the lower extremity, which are the thigh, leg, ankle, and foot, which attach to the axial skeleton. The upper extremity consists of the scapula, which is also called the shoulder blade, the clavicle, which is frequently fractured and is located between the sternum and the scapula. We also call this the collarbone. The arm, or the humerus, which is the upper arm, attaches to the scapula at the proximal end and articulates with the two bones of the forearm, which are called the radius and ulna. The radius is on the lateral side and the ulna is on the medial side when the body is in an anatomical position. The radius rotates around the ulna, which helps us pronate and supinate our hand. There is also the wrist, which consists of 8 carpal bones, the hand, which has 5 metacarpal bones, and the fingers, which have 14 phalanges and finger bones, or finger bones. The lower extremity, which consists of the hip or the pelvic girdle formed by the 2 coxal or pelvic bones, one on each side, with the sacrum and the coccyx behind. Each coxal bone in an infant consists of the ilium, ischium, and the pubic bone. These bones are fused into a single coccyx bone. In the adult, we often call this the tailbone. The acetabulum is a cup-shaped socket which articulates with the head of the femur. We often call this our hip joint. The thigh bone, or the femur, which is the largest bone in our body, connects with the patella or the kneecap and articulates with the femur and the tibia. The lower leg consists of the tibia or the shin bone and the fibula. The fibula is a small bone that is non-weight bearing. The foot consists of many different parts. So we have 7 tarsal bones which form the heel and the back part of the foot. Then we have 5 metatarsal bones which form the parts of the foot where the toes attach. And then we have 14 phalanges, which are the toe bones. The foot has 3 major arches, 2 longitudinal arches, medial and lateral, which is the top part of your foot. And then we also have the transverse or metatarsal arch, which is the bottom part of our foot, our arch, and when that weakens, we can have flat type feet. Here's a picture of the human skeleton in summary. So the blue is the axial skeleton, consisting of the skull, the sternum, the rib cage, and the vertebral column. And the tan part is all the appendicular skeletons, so all of our extremities, our shoulder joints, and our pelvic girdle, as you can see here. So there are some differences between a man and a woman's skeleton. The size is one of the major differences between these two. The man's skeleton is generally larger. The shape of the pelvis, a man's pelvis is deep and narrow, and a female pelvis is broad and shallow. The size of the pelvic inlet, a female pelvic inlet is generally wider and normally large enough for a baby's head to pass through it. And the pelvic angle, the angle between the pubic bones of the female, is generally wider. On this slide, we are showing the different angles of the pelvic bones. On top here, you can see when you just between 2 fingers, the pelvic angle for a male, and then the widest angle is in the female, which is between your pointer finger and your thumb, which is about the angle of the pubic bones in the female pelvis. So there are varying degrees of angles between the two. Joint articulations. So joints make movement possible for bones. Every bone except for the hyoid connects to at least one other bone. The hyoid bone is the one that anchors the tongue. Joints, they are classified by their degree of movement, so there are 3 different types. Synarthrosis, which is no movement, fibrous connective tissue grows between articulating bones. An example of this are sutures of the skull. Amphiarthrosis, which is slight movement, cartilage connects articulating bones. A good example of is the symphysis pubis and the pelvic girdle. So here's a picture of the sutures, non-movable, pubic symphysis, very little movement, but attaches the 2 together. Diarthrosis, which is free movement of joints which belong in this class. Structures are freely movable joints. Joint capsules and ligaments hold adjoining bones together but permit movement of joints. Articulate cartilage covers joint ends of bones and absorbs jolts. Synovial membranes line the joint capsule and secrete lubricating fluid to prevent bones from grinding on each other. And the joint cavity, which is the space between the joint ends of the bones. So here's the structure of a diarthrotic joint. We have a capsule, which you can see here, and a joint cavity and a layer of cartilage over the ends of the joint bones. So you can see that in this picture here. And then you have blood vessels interweaving within that joint capsule. Usually there are very little blood vessels and cartilage, therefore it takes longer for those to heal when there's damage to the cartilage, and sometimes there is no healing and permanent damage. Freely movable joints, we have 6 different types of joints. We have the ball and socket joint, which is an example of this would be our hip or shoulder joint, which permits the widest range of movement. We can abduct, adduct, circumduct, and flex and extend among many other movements depending on which joint it is. The hinge joint, an example of this would be an elbow. The hinge joint only allows movement of flexion and extension. The pivot joint, a good example of this would be the radius, which allows us to pronate and supinate. And then the saddle, which is our thumb joint, is the most common or the most commonly used example. A gliding joint, which would be the vertebrae as they glide to move the curvature of our spine when we bend over or stand up. And the condyloid joint, is an example of this would be the ankle and wrist, and this allows us to move our hand and fingers in various positions. Types of diarthrotic joints, so here's another picture of each one. So the hinge, it shows how it rotates the elbow joint. A pivot joint, which shows how we pivot around the ulna. Saddle joint, within that thumb, how it rotates the thumb. The condyloid joint, I think a better example of these is the wrist and the ankle, although in this picture it talks about the lanto-occipital joint. The ball and socket joint, which is the shoulder and hip joint, and then the gliding joint, which the vertebrae is the most common example for this one.